one of the most underrated and underrecognized methods of THC or cannabis consumption is the tincture. Today, we're going to talk about what it's good for and how to use it. Okay, today we're talking about tinctures, marijuana tinctures, THC tinctures, CBD tinctures. We're going to go through a little bit of the difference between tinctures and edibles or gelatinous cubes in Utah. We're going to go through some of the conditions that you might choose a tincture and the types of patients to treat them with. We have a couple of tinctures here. What type of patient, Kylee, is going to be using something like this versus an edible or a gummy?
So I think every type of patient could use a tincture, but I find tinctures to be my most medical form of cannabis. And so a lot of my patients that are the most nervous about trying cannabis for the first time, or the ones that are more concerned about it looking very medical, they often are the ones that are coming to me for tinctures. They just are most comfortable with this form.
How do you start using a tincture? I mean, it's like I've seen it before. It's a little eyedropper, right? And you're taking a little out, and then, I mean, it looks to me like you can dial this dose in drop by drop if you need it.
Drop by drop. You can change your dosing by such small increments. It's amazing. It's super easy to change anything any way you want to feel about it. But you do want to start very, very low at first, and you just want to put those drops under your tongue, and you want to leave them under the tongue for almost as long as you can stand it. I like to say 1 minute. But if you
that seems like a long time.
Yeah, if you can handle it longer than that, you're going to get better absorption. So I do like to start very low. I generally start my patients on 1/4 of a milliliter or less, depending on the discussion that we have. And then we move up from there every 3 to 5 days about. It's very, very slow process.
Blake, when it comes to tinctures, what's the difference with absorption? Tinctures versus edibles, how are these absorbing?
The first thing I would say is the biggest difference with the tincture and an edible is when you're putting it under your tongue, you're trying to get absorption. You have 2 large veins under your tongue. And so when we talk about sublinguals, what we're really talking about is absorption through the mouth and then getting that across the blood-brain barrier. And so one of the things that about tinctures is you put them under your tongue, you're getting some minimal absorption during that time. So you can start to feel an effect from a tincture within 10 to 15 minutes typically. So it's much quicker initially to get initial relief from a tincture than an edible. What's going to happen is you're going to swallow, and then it actually goes through the same process that an edible will, except for the one change is that you're no longer having to get through and digest the pectin or the gelatin or all the other binding agents associated with the gummy. So typically you'll start absorbing quicker across the microvilli and the intestine using a tincture. The one thing I would say that I agree with everything that was said here is one thing that's different with tinctures is there's lots of different doses, right? And so for certain tinctures, 1/4 of a drop, starting is appropriate. Some you may need to start with half. And so this is why you have to work with your medical professional as well as your pharmacist, knowing what the mgs per kgs or what your milligrams you're going to be taking is for a dose.
This is a good example because, for example, I have two products here, and the total amount of THC in this bottle is going to be different than the total amount of THC in this bottle. Is this something that is a big deal, Kylee, and a big part of discussion? Because
Absolutely.
I know with my patients, the patients that call me back, they're like, well, I don't know how much of the tincture to take. And my response is always the same. Well, we got to take the total THC. And if you have questions, they got to come back and see you.
Yeah, they've got to come back and see me. And I have some tinctures that are actually more concentrated than both of these. And my starting dose for that particular tincture is 2 drops. So we don't do 1/4 of an ml. But yeah, very, very important.
It does seem somewhat complicated for patients in a way. This is different medical, this is just different medical treatment because the patient has to be willing and able to experiment just enough with the different dosing methods, the delivery methods, the onset, different types of products for the terpenes.
I agree. I think all patients should be on some type of tincture. Tinctures should be, because they're a really medical form, the way to think about this is, and I'm only going to speak for Zion on this one, but for Zion, we specifically formulate those tinctures specifically for types of conditions. So for example, the 1-to-1 tincture from Zion is mostly people use it for a sleep aid more than anything else. And that's really what you're probably going for. If you're trying to get a massive head change and so forth, Zion's 1-to-1 is not the product that you want to do for that. Whereas if you look at pain and chronic pain and you need long relief and you need a slight head change but not a debilitating head change, then a 1-to-5 tincture produced by Zion. Zion's 1-to-10 is specifically formulated for things that it has a broad spectrum that has a lot of CBC. So it helps with Parkinson's, potentially MS. It helps with seizure conditions. And it also has just a broad range of other cannabinoids. So people have had good experience with sleep with it. Whereas Zion's 1-to-10 is specifically designed for pain and inflammation. And
That's my favorite tincture.
Oh, I'm so glad you said that. I love that. But so that's the idea. And one of the new tinctures we're working on is a 1-to-10 with CBN instead of CBG. And that's going to be for anxiety and sleep. And so one of the things I like about tinctures, the reason why I think it's good for all patients, is there's a tincture that's going to help maintain a balance, a medical balance for you. I have one last thing to say because I think this is really important. How do you know if your tincture is working? So it's a really weird position to think that you always have to have a head change to figure out whether or not your medicine works. If you were to take an aspirin and your toes tingled every time, that would be a very weird thing to have happen, right? A lot of times when we think about traditional medicine, we think about the absence of some effect. So you take your Sudafed and all of a sudden your eyes aren't watering and you're not having this histamine reaction or whatever that looks like. For me, when I take a lot of different types of tinctures, I don't actively feel like, oh my gosh, I'm ready to do cartwheels. I'm going to, jump up and down or, whatever it is. But, with some shoulder injuries, as I reach for a shirt in the morning, my shoulder always hurts, always. When I'm on my tincture, right, I can reach for my shoulder and it doesn't hurt. I can do this. Normally, without my tincture, I cannot raise my arm without pain, right? And so it's almost the absence of feeling in some cases. I mean, it's really easy for a seizure condition or Parkinson's. If your shaking slows down or stops, that's a good indicator that it's working. But it's not like all of a sudden you feel like, oh my gosh, I know my medicine is working. And so tinctures, I think, are really, really cool, but your effect is going to be different than, say, an inhalation method. You'll feel differently.
Mm-hmm. When it comes to tinctures, I think that it's important to remember that one of the biggest benefits is that ability to dial in the dosing. It seems like that's one of the big advantages. Another good advantage of these is that consistent duration of effect. Blake, you brought up a really great point about being able to microdose or low dose, as we call it, right?
Yep.
With a tincture better than maybe any other method.
Absolutely.
Even our other discussion about edibles, where we were talking about cutting them up and not knowing whether or not that's a consistent amount of THC, tinctures, you don't have that problem. You're going to get exactly the amount you take. So Kylee, talk to us a little bit about the difference in duration is there any difference in duration between an edible and a tincture?
There can be. So it's very individualized. So I have some patients tell me it's 2 to 4 hours, and I have some patients that tell me that it's 6 to 8 hours. So it could be anywhere in that time range, depending on the patient.
Ooh. Sorry. If you are a traditional cannabis user and have taken lots of different forms of cannabis, you're going to actually have more receptors that'll absorb the THC. And so a lot of times, if you're taking a tincture specifically for a head change, or you feel how you know if it's working is that head change, it will actually have less duration. That doesn't mean the tincture is not as effective over that time. It just means you'll stop feeling it because you're absorbing your THC faster. And so one of the things I think is interesting is when you're looking at specific types of tinctures, you're looking for a full cannabinoid profile to get you different effects, not just the THC side. Because again, you can absorb it much quicker if you have more receptors.
So today we've learned that there is a little bit of a difference between a tincture and a gummy. They're going to absorb at a little different rate. The tincture is a little faster. Still give that consistent dose through between 3 and 6 or 8 hours, depending on your tolerance and what the concentration is in the medicine that you're taking. We also discussed that you don't necessarily need that head change or that high or stony effect to make the medicine, to have the medicine be effective in treating your condition. And we also have an additional video specifically on microdosing and low dosing to discuss that directly.